This podcast is for entertainment purposes only and does not substitute for professional medical advice. Please seek a medical professional or healthcare provider if you're seeking any medical advice, diagnosis, or treatment. Thanks, everyone.
Hey everyone, so for this week, we decided to release a Patreon exclusive episode from our Patreon archives. We have so many good episodes in our Patreon archives that we want to bring them out to you guys because it's just not fair to keep these awesome little gems stored away from everyone unless you were part of our Patreon before. So this is one of them. This was a topic that I didn't think I was going to find such good information on, and we had so much fun recording it and just looking up everything on it. It also gives us the time to coordinate our schedules for the summer, given that our kiddos are out of school and all of that wonderful stuff. So I hope you guys like this one and let us know what you think down in the comments or anywhere that you follow us. Thanks, everyone.
Oh, we're recording. One more episode.
That's kind of like our motto for today, that we're batch recording.
But it's okay. We haven't done this in a while.
I know, it's needed. We gotta catch
We
up.
gotta catch up.
And plus, like, I
haven't seen you
feel
in forever.
we've been doing a lot of catching up in the meantime.
Yeah, I know.
Like, in the pauses, we've been like, wait a minute, this thing. Did I tell you?
forgot to tell you.
I
Yeah.
forgot to tell you about this other thing. Yeah. She's been traveling. I filled up a spot for her for that reason. Her
This
September.
episode was so great.
It was very interesting.
Not that I want to be replaced,
You're not.
but his voice.
I know.
He has a great podcast voice.
It was a great podcast voice. We should have him like as a third.
As a third, yeah.
Yeah, to like do I was thinking of like AI medicine, like revamp
Yeah.
it
Okay, yeah.
and have him come in because he has a lot of good insight on that.
I like it. I like it.
I need to like undo this whole recording because I can't mention his name.
That's right. I did see the little thing.
Yeah, I can't.
Okay.
Because of plausible deniability or whatever. That's why there was no video of it either.
Yes, exactly.
Anyway, we could.
Plausible deniability.
That's what he told me.
What is that?
I don't know. Ask him. Some police term.
Okay, sure.
Some police
Sure.
term. Anyways. Yeah, so I hope you guys liked that episode too, because it was very interesting. We're thinking of having him in. I know we did AI in medicine like a while ago, but it'd be cool to do it like in his
Perspective.
Like, yeah, when it comes to law enforcement or like fraud and all that stuff, which, you know,
IT. It's a huge
that's
background
it.
in IT.
Oh yeah, huge.
So
It'd be interesting.
yeah, it'd be
Anyway.
really interesting. And his work is in that line of
Yeah. Well, he has a lot of experience
the
like,
force. Yeah.
everywhere. Yeah. Hence the.
We're talking too much. I don't wanna like
I know.
put it out there. So anyways, he's really good at these kind of things. and
Yeah.
Maybe we can bring him back just to get his perspective.
Yeah.
I love the way
absolutely.
we have other people on the podcast.
Yeah. Yeah.
And we hope they
gotta-
love it too.
I know we got to do more of that. But anyways, so hi Patreon
Hello.
patrons, you MVPers out there, you guys are the best. And toast for you guys.
Don't.
It's been a week, guys. It's been a week. It's been a month for you.
Yeah, I know.
You know.
You can tell it's my voice.
Yeah. It's just been a lot, but we're here.
We're here. We're ready. We're loving it.
Yeah, we needed. I mean, that's the thing about recording days. Like, they just they
Pump you up.
They boost the morale.
I know.
You know.
Love it.
Anyway, so today we're going to be talking about something that you had brought in.
Yeah.
Like, I think even last year, but we just ran out of time in October last year to do it. And it's on old-timey electroshock therapy. Oh, yeah. And it's still being used. Just
Yeah.
not the old-timey aspect of it all.
Yeah, I mean, things have changed with electroshock therapy.
Radically and for
But
the
we're
better.
gonna like talk because it's October. Could be. We're gonna talk about like that old.
Yeah,
kind of
we're
electroshock
definitely
therapy.
We're gonna bring that up to the forefront, and then we'll end it up with how is it still being used today? Because I mean, it does have its benefits.
Yeah.
So, start it off, Doc.
Right. So, what is electroshock therapy? Electroshock therapy, ECT for short, was a treatment method used in 1930s, around 1930s
Around
it
there.
started, and then often portrayed as harsh and extreme, and like your only option left.
Yeah.
Now, modern ECT it's a lot more humane.
Yeah.
First of all, it's safer, it's more controlled. compared to the earlier versions that were like just really off-putting and unsettling. So ECT involves sending a small electrical current through your brain to induce a brief seizure, right? This is done to alter the brain chemistry in a way. Chemistry.
You see, it happens. It's
Chemistry, yeah.
weird. Like, I don't know why that
I don't
happens to
know.
us.
So it alters your brain chemistry in a way that it can alleviate some symptoms that you might be having of, like, let's say, a severe mental illness.
Yeah.
So particularly when other treatments and medications and therapy and all these things haven't really done much for you or just are not working. So that is ECT
In a
in a nutshell.
Yeah.
Jules is going to talk about the history of it.
Yeah. So it's
Slide into the creepiness.
Yeah, exactly. So let's start off with who created all this on a very eerie stuff that will probably be kind of reminiscent to like the typical thing that you would imagine of the horror movie electroshock therapy type of situation. So ECT was developed in 1938 by Italian neurologist Ugo Serletti. I think that's how you say it. I tried to do it in a very Hispanic.
But I was going to say,
Serletti.
yeah.
Very emotional.
Yeah. I mean, it's Italian. I feel Italian has to have that oomph.
It does.
Anyway, exactly. Anyway, so inspired by observing pigs being stunned with electricity before slaughter. We literally you guys are watching.
That was his
Inspiration.
inspiration.
It's before slaughter.
It's like,
Like,
can we do this to humans?
yeah. I don't know, but that's his train of thought, right? So the goal was to treat patients with severe mental disorders, especially schizophrenia, depression, and mania, which were not well understood at the time.
Yeah, and he understood perfectly after he saw a pig being shocked.
Before slaughter.
Before slaughter, yeah.
That's the thing that drives me nuts. It's like, it's on its way to die. How are you helping someone out with that avenue?
The thinkers back then, you know?
Oh, Sedledi. Yeah. So before ECT, some extreme treatments like insulin coma therapy, where patients were injected with large doses of insulin to induce comas, were common. Things from back then were wild. ECT was seen as a less invasive and more effective alternative, believe it or not. So electroshock was considered progressive for that era.
Just like to induce a coma, they gave you insulin, and just, you feel so shitty when you're hypoglycemic, like sweaty, diaphoretic. So to a point where you are going into a diabetic coma, right? Just, I don't know.
It's Anyway, okay. So how it happens then from that train of thought to full-on electroshock. So in its earliest days, ECT was administered without anesthesia or muscle relaxants, making it quite traumatic. So patients would experience violent seizures that would lead to broken bones or other injuries. The procedure involved attaching electrodes to the patient's head and delivering shocks of varying intensities. Early machines lacked precision, making the experience unpredictable and in many cases painful. However, because it seemed to provide some relief from symptoms of severe depression and schizophrenia, it gained popularity as a treatment method. So patients who had been unresponsive to other treatments sometimes showed improvements after ECT, reinforcing the idea that it worked even though it was still widely misunderstood back then.
Yeah.
So, I mean,
Yeah.
it's wild. There was so much misunderstanding on mental health.
Yeah.
And then they used things like this to quote unquote treat it.
Yeah.
And it's just wow. So much has changed, from then.
And sometimes against people's wills.
Oh, no, most of the time. Yeah. In these mental institutions, asylums back then and stuff like that, of course. Of course. If you guys want to know more about a prime example of something like that, look into Rosemary Kennedy.
Yes.
And her lobotomy. Like, completely without consent. She wasn't even aware of it. Her mother didn't even give consent. It was just her father.
That was really
horrible story on that poor woman. And it was just completely just misunderstood mental illness. Yeah. Crazy. Anyway.
So why did we do electroshock therapy, right? ECT was commonly used to treat a wide range of mental disorders, but it especially was popular for cases where patients were severely depressed, suicidal, showing symptoms of psychosis, In many mental asylums during the 1940s and the 1950s, electroshock therapy became like a really routine practice.
Yeah.
And it was often considered a last resort treatment when all other options had failed. However, it also gained a controversial reputation as it was sometimes administered without the patient's consent or in inappropriate cases. The mental health field was struggling with a lack of effective treatments during this time, and ECT kind of filled in that gap, even though it was not perfect. Mental asylums often used it liberally, right? And the lack of regulation led to its overuse and contribution to the stigma that it carries today.
Yeah, horrific.
Yeah, and it's just the way that it was done before. It was like animalistic.
Yeah, because again, no pain, no like
No sedation.
exactly sedation.
No anesthesia.
Nothing.
You felt everything. You felt the anxiety of that they were going to do it. Like, right, it's just a lot that goes into that.
Yeah.
And, oh, man, that was terrible.
Yeah.
So, mental asylums and electroshock therapies in the mid 20th century housed people with wide range of mental illnesses and issues in general, from mood disorders to schizophrenia, and ECT became a symbol of these institutions where overcrowding, underfunding were major problems. And then the procedure was sometimes seen as a way to manage difficult patients. Imagine you're just a difficult patient and the only way that they're like gonna, like control you is that they're gonna like shock you.
Yeah. Or they don't understand what's happening.
Yeah.
And that's it. That's their solution.
Exactly.
Oh my God.
And, it was occasionally misused and a means of control rather than treatment, which is so sad. And then there was like a public outcry of negative depictions in the media, such as One Flew Over the Cuckoo's Nest, which is probably the biggest one, even though One Flew Over the Cuckoo's Nest is also lobotomy too, right?
Yeah.
So that also further cemented the reputation on electroshock therapy that it was basically like barbaric.
Yeah.
So yeah.
So some symptoms and side effects from this really intense therapy, at least back then. The immediate effects of early electroshock therapy included confusion, memory loss, headaches, and nausea. And then you got the long-term side effects, which included memory issues, especially for events that occurred just before the treatments. And then patients would sometimes even forget entire chunks of their lives, okay? Making it like incredibly scary for these patients. I mean, come on. And then additionally, the unregulated nature of ECT in the early years meant that doses of electricity were not always properly calibrated, increasing the risk of harm. Despite these risks, many patients did show improvement, particularly in cases with severe depression. This conflicting outcome did benefit some, but definitely harmed others. And then it contributed to the whole controversy of the whole therapy as a whole. And then modern perspective, ECT has undergone significant evolution since then, okay? Modern ECT is far more refined now and considered safe and an effective treatment for several severe mental health conditions that are resistant to other forms of therapy. So we're going to take a little bit more of a further look into that with EB, but yeah, it's different now.
It is very different now. Today, ECT is primarily used in cases where medications and therapy have not been effective. And when the condition is so severe that an immediate intervention is necessary, that's when they're going to use it.
Yeah.
So it's generally used in the following situation. So one is severe depression. So severe depression, ECT is the most commonly associated treatment for resistant depression. It's kind of like our last line of therapy, which we can offer. And then it means that the patient has not responded to multiple antidepressant therapies and or other therapies. Right. So it's especially beneficial to individuals with major depressive disorder, which is depression, right? Like an active depression, and even that major depressive disorder that could be mild, moderate, severe. And these are people who are experiencing suicidal thoughts or severe symptoms like inability to eat, sleep, function normally in a daily life. So much so that they are willing to do ECT to anything to help them get out of that. And it does work sometimes.
Yeah. I mean, it even worked back then sometimes.
Yeah. So
in those barbaric
times. Yeah. And then, so now talking about like it working, its effectiveness, right? So studies have shown that ECT has a 70 to 80% success rate in alleviating symptoms like severe depression, often making it more effective than medications for some patients. And many patients experience significant improvement just after a few sessions. So it's not something that it's like chronic that you're going to have to be doing always. The other time that we use ECT is also in bipolar disorder. ECT can be really helpful in treating both depressive and manic phases, which manic phases is kind of like a highlight in bipolar disorder. It's particularly useful in cases of acute mania, where the patient might exhibit symptoms of like extreme agitation, hallucinations, psychosis. You can also have rapid response. So ECT is often used in emergency situations where a rapid symptom reduction is needed, especially when the manic episodes lead to dangerous, impulsive behaviors. That kind of brings me a little bit back to the barbaric.
I was gonna say that's like a very jump the gun type
Yeah,
of.
you could do a lot to control someone, then shock them.
Yeah,
You know.
I feel like there's medications for that, like
And if it's
injectables
such,
and stuff.
yeah, if it's such like an emergency, I just don't know how you're going. I mean, I'm not a psychiatrist.
Yeah.
I'm more than willing to learn more. But if it's such an emergency, such like that, like there's so many other ways that you can use that, but that is one of the times that you use ECT. And then also in schizophrenia, it's less common that you use ECT, but when the patients are experiencing something like catatonia, so they like don't move, they're just unresponsive, or a severe psychosis, or they're resistant to their antipsychotic medications, they'll use ECT. So catatonia, just like I had mentioned, it's considered one of the most effective treatments, ECT, for that. And it's a rare but serious condition that involves inability to move, speak, or respond to anything. So you're just like in this psychological state of you don't want to do anything. You're just catatonic. So it's you don't move, you don't speak, you're very slow, even if you do move.
Correct me if I'm wrong, but does that happen sometimes of like shock from like a traumatic event or something like that?
So shock from a traumatic event is different.
Okay.
Catatonia is something that happens specifically in people with schizophrenia.
Okay. So it's only to schizophrenia. Okay.
Yeah,
All right.
exactly.
So when they get to that catatonic state.
Yeah, exactly. It's a catatonic state. But I mean, people like stay in like this stuck state.
Really?
You know, like a person that's just sitting for days.
Oh, okay. Now I understand what you're saying. Okay.
Days.
Yes.
You try to move them, they don't want to move.
Yes.
Like they do not move. They do not speak. They don't respond. They don't eat. They don't do anything.
Yeah. Wow. Okay.
You can postpartum depression is actually a really big one.
I just learned about this now. I didn't know
Yeah,
that this was.
it's one of the ones that I knew mostly of because I was like, oh man, like postpartum depression, that's like a lot to do with electroshock therapy.
Yeah, okay.
But it can be a life-saving treatment, and it's actually safe for moms that are breastfeeding because they're not drinking these medications. And also, like we said, like sometimes people just respond to a couple sessions. So
True.
imagine this can be something that's really effective.
Right.
And especially for someone that's going through that, a postpartum where, you know, you're aware that you have a baby and that, you know, you have all these things, like you feel like you need to be present.
Yeah.
I feel like now that it's changed, ECT has changed, like it could really be life-saving for a lot of women.
100%.
There's ECT for Parkinson's and other neurological disorders. So there's a lot of recent research showing that ECT can be beneficial for a lot of these disorders, such as Parkinson's. And it can, like in Parkinson's, it can really relieve a lot of their severe tremors or their rigidity that they're really known for. It's not a first-line treatment, obviously, but it can be used when other things are not sufficient.
Right.
We had already mentioned suicidal patients. So ECT is sometimes used to quickly reduce that risk. And it's one of the fastest treatments for suicidal depression, with patients often seeing a significant reduction in suicidal thoughts or after just a couple of treatments.
Which is interesting. I wonder what's the link between like it having such a successful rate with depression, right? There's like that's like kind of like the underlying like success factor, like common denominator there, like with depression.
Well, I think it's just all these neurotransmitters and things that we have, all these neurohormones, right?
Yeah.
And it's a imbalance of those, right? And when you send a shock, what you're doing is kind of like electrically, right? Kind of
like stimulating,
right? Changing. So, and it's just like in a couple of sessions.
That's the thing. And it's so dramatic from the difference with taking medications for depression, which sometimes you have to take lifelong, you know?
Yeah.
So it's so, you know, it's interesting how that's so different, you know?
Yeah.
But anyway, so how modern ECT works. Modern electroconvulsive therapy is much more controlled and sophisticated than what we had first talked about. So now we use anesthesia and muscle relaxant. Unlike early ECT, today's procedures are performed under general anesthesia. Muscle relaxants are also administered to prevent violent muscle contractions during the induced seizure, reducing the risk of injury. And then there's also precise control. So not like before that, they didn't even like really calibrate these machines. It was just shock.
Yeah.
And it's crazy. So modern ECT machines allow doctors to precisely control the amount of electricity being delivered, ensuring that only the minimum effective dose is used.
Yeah.
This minimizes the side effects while maximizing the therapeutic benefits. Then you have unilateral versus bilateral ECT. So in the past, ECT was often administered bilaterally all throughout, right? Meaning electrodes were placed on both sides of the head. But today, lateral ECT is often used where electrodes are placed only on one side of the head, usually the non-dominant hemisphere. This reduces the risk of memory loss and other cognitive side effects. And then there's also short sessions, right? So modern ECT treatments are brief now. So they typically last no more than a few minutes. A typical course consists of 6 to 12 treatments given 2 to 3 times a week, depending on the patient's condition, obviously. But yeah, it's pretty different.
Yeah. And one thing that I was always curious, I'm like, what are the side effects? Right?
Yeah.
So I don't know. The first thing I thought about was headache or maybe amnesia. Like I can't remember.
Well, yeah, some patients did.
Yeah.
That's why now they do unilateral.
Yeah, exactly. So short-term memory loss is one of them. A lot of patients experience short-term. So like the most recent memories, they're kind of foggy or maybe they don't remember them at all.
So interesting.
And around the time of treatment. So they're not going to like remember that, which honestly, maybe I would not want to.
Yeah, maybe it's best.
Yeah. The memory loss is also sometimes just temporary. Obviously, you just had a shock, right?
Yeah.
It's probably going to come back little by little. But in rare cases, many patients have longer lasting issues with recalling events such as before or after the treatment. Confusion. So patients may feel pretty disoriented or confused for a short time after the treatment, but this can resolve really quickly. But I mean, sometimes could that also be a part of the anesthesia?
Right.
You know?
Right.
Headaches and muscle aches. So some individuals experience of mild headaches or muscle soreness following an ECT, but these side effects are also usually managed with over-the-counter pain medications. And of course, remember when you're having a seizure, you are tensing up, your body is tensing up. So you can become actually pretty sore from that. It's like almost like when you're like working out or like in a car accident that you like tense up really quickly. And then the next day you're like feeling super sore and you have no idea why.
Right.
We'll talk a little bit more about the benefits and effectiveness of ECT. There's really high success rates, so that's really great. For patients with severe depression, bipolar disorder, catatonia, modern electroshock therapy can be really effective for that. Rapid results is another one. One of the major advantages is that you don't have to be on these antidepressants for 3 to 4 months. Not saying that that's not an option, right? But, many patients begin to notice improvements just after a couple of sessions, which can be really life-saving for a lot of people because sometimes when I tell someone, hey, this is something that's going to take a little bit of time, maybe, like it's going to take even maybe like 4 to 6 weeks for you to even start feeling some relief from your symptoms after just taking an antidepressant. And some patients are like, it's going to take a while.
Yeah.
Right.
Yeah. Mostly when you're in such a
low state. Yeah. So I feel like this is a really big benefit, which is probably why if someone is suicidal at that moment.
Yeah.
And it's like they want like a fix, right?
Exactly, yeah.
Like right away, maybe that is a right option for you.
Yeah.
Life-saving or suicidal patients.
Life-saving for
Life-saving for suicidal patients.
Literally what you were just saying.
We were just saying.
Yeah.
Again, it's considered critical treatment for those people. So this is an option for them. And it could really eliminate that risk of harming themselves immediately.
Yeah. So ECT in popular culture versus reality, because it's one thing you see on TV, movies, and whatever, and really what it is, right? So modern ECT often suffers from all of those misconceptions due to its portrayal in movies and TV shows. Like the film that we were talking about, like One Flew Over the Cuckoo's Nest. Yeah. They depicted it as like cruel and painful treatment, so reinforcing that stigma, right? From way back then, from like the 30s or 40s. But the reality is very different now. from way back then. So in fact, modern ECT is conducted in a highly controlled and humane manner. Patients are fully informed about the process, different from before, and it's typically only used when other treatment options have failed. So the goal is to offer relief from severe life-threatening mental illness. And for many patients, it provides significant improvement in the quality of their lives, right? I mean, I hope this like helps people or, you know, whoever is listening to this or interested in this,
Just
like
understand more.
it's different now just because I know it sounds intense because
Because of the stigma.
exactly, you know, so if somebody brings this up to you, you know, your therapist, your doctor, what have you, brings this on,
Or
it's
a family member.
exactly, you know, that this maybe is something to explore. Don't let the stigma of it deter you from exploring it, because maybe it's a really good option for you depending on what it is. I'll talk to your doctor about it, all that good stuff. But it's so vastly different from back then. It is not what you see in the movies and from the freaking 50s and whatever mental asylum, the freaking no, very, very, very different now. Like we're talking about not even the whole brain is affected. It's only unilateral, as we had said. These machines are using the most minimum amount of electricity, you know, just for that therapy. It's not like the barbaricness of before that it was just like not even calibrated. These machines were just shocking people. It's not that at all. This is very different. Just like how people use what do you call it?
The shock.
For cardiac.
Yeah, the electroshock pads.
Yeah, you know, if people could use that to you know, what is it like to restart the heart, to like, you know, all that.
So, restarting your brain.
Yeah, exactly. So it's kind of like the same science and that.
Reboot.
Exactly. So yeah, that was electroshock therapy.
Yeah. I hope you guys enjoyed
electroconvulsive
that.
therapy.
Yeah. And gained some insight.
Yeah.
For people that maybe had some questions around it.
Exactly. And I know that some people like didn't even know that this is even still a modern treatment.
Oh, wow.
Yeah. There's some people that are like, no. That's
Well, I'm
only, like,
sure.
this back then. Yeah.
And it's not, and again, with the stigma, I'm sure that if a person is receiving it, they're probably not
Won't say
saying
it.
it.
Yeah, exactly. Because then they'll be like, oh my God, you know how people are.
Yeah.
Especially when mental illness, we've gotten a long way.
A long way. Yeah.
But still, there's still taboo. There's still stigmas to it and all that. But anyways, hope you guys liked it. Thank you, patrons. You guys are the best. And we'll see you on the next one.
Bye.